Hey everyone, Dr. Matt Geller here. I'm here with an old-time friend, Dr. Christine Ng. Thanks so much for coming on.
Thanks for having me.
She's practicing at Clinica de la Raza in Oakland. And we're talking today daily disposables, especially in that young patient. Fill me up to speed with the way that you're thinking about young patients, the way that you're thinking about daily disposables, and is it an option for them? How do the two kind of go together? I think it's a perfect fit, but with some things to be careful of.
Yeah, so I personally think daily disposables are the best option for the younger patients just because of the hygiene factor. You know, it's something they don't need to worry about taking out their lens at night and cleaning it. You know, what solutions do they need to use? So we want to eliminate as much of that error as possible and give them an easy and comfortable solution that will fit their daily lives.
What are some of the scripts that someone can take home and an optometrist or ophthalmologist can take home and start using in the exam room to kind of get that conversation started, or maybe once the conversation's started, things that really help drive home the value?
I think it's ease of use. I think it's good for sports. A lot of children now, wow, they do a lot of things that I didn't do as a child. They're just involved in so many activities, so I feel like, you know, sometimes wearing glasses will be cumbersome to some of those activities, so I tell the parents, you know, if you really want something that's easy for them to use, a daily disposable will be great for their lifestyle. Anytime I see a patient who's in a monthly lens or a 2-week lens and they come back complaining of comfort or maybe something related to allergies, the first thing I think of is, hey, let's put this 1-day lens on you and see how you feel.
Yeah.
And usually, well, I would say 99% of the time, they're just like, this is great, just give me this prescription.
Yeah, how important is or different is insertion and removal training when it comes to younger kids, teenagers? Is it different than working with an older patient?
I do think, you know, the basic premise is about the same, but the daily disposables, sometimes they're just a little more floppy, so it takes a little more patience. But I think once they get it, and if they have the motivation to wear contact lenses, they're going to be all over it. You know, they're going to give it their 100% and they will get it eventually. If a patient's never been fit into contact lenses before and I put them into that 1-day lens, they're going to be used to the comfort of that 1-day lens. It's so much thinner. It's, you know, you can barely, or you actually don't feel it on the eye at all.
So what are some of the questions, just easy questions you can ask to get the conversation started and better understand if the child would be a good candidate for daily disposable lenses?
So the first thing I ask the parent is, you know, are they responsible to take care of contact lenses? And then sometimes I have a conversation with a parent on the side. You know, how is your child really feeling about glasses? Did they raise any concerns with you? You know, do they feel like they might be bullied at school or there might be a stigma to wearing glasses? And that's a good segue to say, hey, I think that they would be a good candidate to wear contact lenses, and it will give them that boost of confidence in school that they really need.
Yeah, there's so many factors here. It's not just how the lens fits on the eye. It's not just what your clinical findings are. It's not necessarily about visual acuity. I mean, there's such a cosmetic side to this and the hygienic side too. That's so critical, I think, to keep in mind.
Yeah, and we want the patients happy too.
I want the patients happy. That's the most important part. But happiness, right, comes in a lot of different flavors.
Right.
So, oh, I can see clearly, but I look silly, or whatever it might be, or I can see clearly, but I'm uncomfortable. Not good enough. You've got to check more boxes than that. So one of the things that I found in practice was that younger patients, it was nice to get them in daily disposables early, and I found that they're more likely to be successful with time. So over 3 years, watching a patient that I was in practice, seeing a patient go from their first lenses all the way through, seemed to encounter maybe less issues. Maybe it was more ingrained, they were more comfortable with it, it became part of their lifestyle, they had less biases. So what are you finding there?
Yeah, I completely agree. I think it's a great practice builder. You know, if you start your younger patients in the daily lenses, then they're more likely to use that going forward. They're not going to go back to a monthly or a 2-week lens because they're so used to this modality and how easy it is to wear and take care of that they'll really wear the 1-day lenses going forward.
Perhaps their ability to retain information at a younger age, let's say kids 10 and under perhaps, it may be more tricky to kind of keep in mind this health-related stuff. So you've got to distill down your message into something that's very simple, very straightforward. They're not going to be taking out a pen and paper to write like a parent might. So what do you get across? What are the essential pieces that the child or teenager must remember when it comes to their new contact lenses, especially daily disposables?
I think the most important things to remember is just Make sure your hands are clean before you touch them. And you'll just get up, do your daily routine, put them in. At the end of the day, you just take them out and throw them away. So simple.
Yeah. And I think that's the key part is throw them away. That's the whole point. Don't try to reuse these. That's when problems happen, right?
Yes, exactly.
So I remember a patient that came in, young girl, she must have been about 8 years old, and had tried, I think it was 2-week or monthly lenses before, was unhappy. Obviously, she had a higher prescription, maybe about a -6, -7, something like that. Disappointed with glasses, and confidence was a big issue. Put some daily disposables on, forget which lens it was, but ultimately extremely happy. The follow-ups were great. We were like one of the most influential people in her life at the time. Any success stories on your end?
Yeah, so I will see a lot of kids in my practice who play soccer, and every couple months or so, the parents are bringing them in, the glasses are broken, something happened, they can't see. And so one of these little boys I had just fit into daily disposables, and I didn't see him for a whole year. It was great. He had no issues with his glasses because he wasn't wearing them. They weren't getting broken. And when he did come back to see me, he said how great it was to see the whole soccer field without the obstruction of his frames.
Yeah, absolutely. What are some of your favorite brands that are good starters for some of your younger patients?
Definitely my go-to brand is going to be the Acuvue Oasis One Day because it comes in the 2 base curves, so it will fit pretty much 100% of my patients. And then it has that high oxygen permeability, which is going to be great for the health of their eyes.
So for anyone out there who I think is curious to start fitting patients in daily disposable lenses, or even parents or kids watching this, it's certainly a viable option and a great thing to talk to your eye doctor about. So go visit your optometrist. If you're local in Oakland, go to her.
I'd be happy to see you.
But thank you for coming on, and we appreciate all the insight. Thank you.
Thank you.
Yep.